Hi everybody, today we're talking about choking. First of all, we need to talk about obstructions. So there are two types of obstruction, what we call a partial obstruction and a full obstruction. A partial obstruction is where they can still get air over the vocal cords, which means they may be holding their throat but they'll be still making some form of noise. So they may come up to you and say, "Oh, I'm choking." Okay, then you've got a full obstruction. This is where there is no air getting over the vocal cords, therefore they won't be making any sound whatsoever. They may be holding their throat, their eyes may be bulging, they'll be going a funny colour, but there will be no noise whatsoever. Okay, so with that in mind, you still treat them both exactly the same though, and there are 3 steps to deal with choking. First step, get them to cough as hard as they can, to do a nice big hacking cough. Hopefully that will help to loosen whatever it is that's causing the blockage. Okay, once they've done a cough, you then go on to step 2. Step 2 is 5 back blows. Okay, a back blow is where you use the heel of your hand, the hard part, and you hit between their shoulder blades, okay, as hard as you can. It should hurt you and hurt them, and you know you're doing it hard enough. Okay, so hit them as hard as you can, and you want to do 5. Obviously, if it comes out on the second back blow, you don't need to do the other 3. All right, but you do 5 back blows. If after those 5 back blows it hasn't come out, you then go on to step 3, which is an abdominal thrust. Now, an abdominal thrust used to be referred to as a Heimlich manoeuvre. It's exactly the same technique, but we just now call it an abdominal thrust. All right, so again, you do 5 of these. All right, again, if it comes out after the second time, you don't need to do the other 3. All right, but you do 5. If after that 5 it still hasn't come out, then you follow the cycle again and go back to step 2, where you go for your 5 back blows. Okay, and then 5 abdominal thrusts, and then circle it again. So 5 back blows, abdominal thrusts, etc. And just keep circulating. All right, after a couple of minutes, if the blockage hasn't been released, then what will happen is they will then just pass out and lay on the floor. Okay, obviously because they've passed out, you're going to have to help them to the floor, and then you're going to do compression only CPR. There's no point doing the breaths because they have a blockage in their windpipe, so you just do compressions only constantly. Okay, and then what will happen is the pressure will build up in the chest cavity, and then when it hits the maximum, whatever is blocking will then pop out like a cork. Okay, so they are your 3 stages. So cough is stage 1. Stage 2 is then to do 5 back blows. Stage 3 is then to do 5 abdominal thrusts. Now, if it's a child you've done this on, they must go to hospital. All right, they must. Even if you remove the blockage, they must go to hospital. If it's an adult, then you advise. Okay, and then it's down to them because they're an adult. But you do advise them that they must go to hospital and be checked out, because by doing the abdominal thrusts, you can rupture the liver or even the spleen. Okay, so it's always best to be safe than sorry. So that was choking. Obviously, come along to one of my courses and you'll be able to use my brilliant choking training device, in which you can do the Heimlich manoeuvre and practice your back blows. Okay, but otherwise I'll speak to you soon. Bye.